All right, thanks, Dan. What's the one thing that can stop a world-class athlete? For one Olympic skater, it was battling blood clots that overtook her body. In our continued partnership with Intermountain Medical Center, we highlight the work being done by two thrombosis experts at IMC and why their recently published guidelines aim for better diagnosis and treatment. Olympic long track speed skater Rebecca Bradford-Plath raced onto the international scene and into the top spot of Team USA at the Vancouver Olympics. 6 years later...
Well, may I take a listen to that spot on your line?
Of course, yeah.
Okay.
Rebecca is back at Intermountain Medical Center for one of many checkups, suffering from lingering pain after nearly having a stroke or heart attack due to blood clots.
Clots are probably the most common serious disease you've never heard of.
That's why Intermountain Medical Center Thrombosis Clinic co-director Dr. Scott Stevens, his partner, and 13 other thrombosis experts from around the world gathered to present new guidelines for blood clot detection, treatment, and survival.
Sets up a scenario where a doctor might encounter a patient in a certain circumstance, asks the key questions that are necessary to treat that patient properly, and then advises the doctor on the choice of treatment to use in that situation.
All in efforts to prevent misdiagnosis. Rebecca was all smiles on her wedding day, June 2012. 3 months later, her new husband found her curled up in a ball in pain.
That I had a bilateral pulmonary embolism, I had a partial infarct, and the pain that I had around my rib that I experienced from colliding with a friend playing ultimate frisbee was a blood clot that burst and bled.
She had blood clots all over her body for months, but 6 months of misdiagnosis meant the clots spread from her legs to both lungs.
Missing the Sochi team by 1/10 of a second, I know that that's my greatest success for survivors around, that they saw that and that they have hope.
Nearly 500,000 Americans suffer from blood clots each year.
It actually will cause the blood to stop flowing from the heart into the lungs, and with no blood flowing into the lungs, the body can't get oxygen, and that's the cause of death when blood clots are fatal. Nice, slow, strong athlete's pulse like usual.
That's why Rebecca shares her story, especially now with new guidelines.
It's a way for every doctor in the country to use the best possible scientific research from the highest level experts and treat their patients just like the top level expert would.
The initial warning signs of a blood clot is usually an achy, deep, constant pain in the leg. Rebecca says she lives by the motto Dr. Stevens told her when first diagnosed: live each day as normally as possible.